I get patients all the time. I got a patient yesterday. He and his wife attended. His calcium score was like 217, 215 or something, back in 3 years ago, 2017. And then a year later, it was 235, something like that. His wife was a healthcare provider. She did a lot of work in terms of taking over his health. She got him on a keto diet. She tried chelation a couple of times. She did a lot of work regarding the supplements. With the diet, with several other things, she was nailing it. She got it right. And he was doing the hard work. He was doing a lot of the right kind of exercise. They were doing what they needed to do. Then, on a follow-up calcium score, it came back 350. She was devastated. She was so frustrated. And we actually started going into the labs. They looked at it. They knew about my channel. That's why they came to see me. And here was the issue. It appears that just over the past couple of years, this gentleman has developed some very significant diabetes. And he was beyond 60s. He was into his 70s now. And that's what tends to happen to us. The older we get, the more challenge we have with insulin resistance. Those insulin receptors start working less and less and less. It was such a relief for them to find out what was going on and feeling like she broke into tears at the end of the meeting and she said, "Doc, I'm just so grateful that we found you. I'm grateful that we found what the problem is because we know that we can deal with this. We're already doing a lot of the right stuff." It was just so frustrating because we kept going to cardiologists and they would just want to give us more statins, and they said the LDL was fine. That I knew LDL was not the issue, but they kept going around in circles on that. They just were not getting us where we knew we need to be. We feel like now we know what's going on. So again, there's a lot for her to be thankful for. There's a lot for us to be thankful for as well as we continue to learn how we can extend our non-disabled healthy life. Why wait for a disease and hope for a cure? I used to be an ER doc. My name is Ford Brewer. I quit ER after a few years because it was just so frustrating. Most of the things bringing people into the ER are things that should have been prevented, including heart attack, stroke, #1 cause of death, #1 cause of permanent disability. People think that you're just going to have those and that they're not predictable. Both of those are wrong. They are predictable and you don't have to have them. Usually it's lifestyle. Lifestyle is more important than supplements and even prescription drugs and even stents and surgery. But the current times are tough. Major financial impact with the lockdowns that most states have been going through. We've been working on a way to make this much more affordable with a subscription process. And that's exactly what we're announcing today. We've got 2 levels. One is the silver membership, where you get access to our courses, a private webinar each month, and access to our supplement store and supplement recommendations and prescription. Or I would suggest even more so, the gold membership. You can get a script for a Freestyle Libre and find out what your blood sugar metabolism's doing on a daily basis. And you can get a lab order for inflammation, OGTT, and insulin survey. You can also get a 30-minute one-on-one with me. So I'm looking forward to seeing you. Cost is no longer an excuse. So if you're interested, go to go.prevmedheartrisk.com/prevmed-subscription or call us at 859-721-1414, 859-721-1414, or email us at myhealth@prevmedheartrisk.com. Looking forward to seeing you. Thank you.